I'd love to introduce Dr. Jennifer Redmond Knight, who is a facilitator and public health professional who helps leaders who are responsible for coalitions, partnerships, and teams figure out how to get people to work better together so that they can make a greater impact than they would by themselves. Dr. Knight does this through her consulting business as well as her role as an assistant professor at the University of Kentucky College of Public Health and as a member of the University of Kentucky Markey Cancer Center Cancer Control Program. She also serves as a co-principal investigator for the Kentucky Cancer Consortium. Dr. Knight has experience and interest in group facilitation, partnership and sustainability, leadership, emotional intelligence, program development, evaluation, cancer prevention and control, epidemiology, and policy systems and environmental change efforts. In 2017, Dr. Knight launched a website and a weekly blog focused on helping people work better together. You can find that at jredmondknight.com, and I'll put that link in the chat box here in a moment as well. Dr. Knight has her BA in Communications, an MPH in Epidemiology, and a Doctor of Public Health in Health Services Management from the University of Kentucky College of Public Health. Jennifer, welcome back.
Thank you. So glad to be here and excited to discuss this topic that is important for me to remember and kind of check in with myself as well. So, I've had an interesting experience that probably puts me a little bit more in the seat of being a work group member or really a work group leader recently. I'm serving as the chair of our Smoke-Free Little Rock campaign, and I'm doing this as a volunteer. Although there's a lot of things I could do because of my experience in policy change and that kind of thing with the cancer realm, I really am a volunteer in this place. And so what's been interesting about that is I really have a lot of interest, a lot of passion, but I have very limited capacity. I'm not able to do what I might even want to do because I don't have capacity to do it so that I can do the other things that I really get paid to do and prioritize my family and those kind of things. So there's really limited time. So it really has been critical to have other folks who are staff, really. We've got a nonprofit that's really leading the charge. And it's been incredibly helpful and incredibly important for them to be able to schedule the meetings, handle the logistics, and let me know the things that I need to really be at and the things that they can handle on their own. So it's really been an interesting experience to kind of wear a different hat and to kind of put into perspective the importance of, yes, we're in this together. Yes, we can do this, but we can't delegate everything or really most things to volunteers. So as I'm thinking about this, I'm just going to encourage you guys as we start to really be mindful of the roles of staff, work group leadership, and work group members as we kind of think through what that might look like and when we would delegate and when we might not delegate. So I'm going to encourage you all first to assess the situation. Really think about what are your current work groups? What is the current leadership? Do you have leaders? What are the members? What are the implementation strategies? What is the past progress? Those kind of things to really help you understand what's going on. Now, this can, of course, be applied to your board, to other committees and other situations. But for this context and today, we're going to apply this to work groups. But again, it can be applied in other ways. So I'm going to encourage you all, again, as you assess the situation, to figure out really what needs to be done and then find out who is the best person to do this. And so the start off for assessing the situation is really best done by staff. Again, although volunteers often could do it, the best kickoff there is going to be staff starting the conversation. So what does that look like? Well, work groups. As you're thinking about the work groups, you may have work groups listed, but are they active? Which ones are actually doing things right now? Leadership. Which work groups have leadership? They may be volunteer leadership. And who is staffing your work groups, or who's assigned? Is there a person assigned to provide support and leadership from a staffing perspective for your work groups? Then thinking through, what are your implementation strategies, or what are you planning to implement as a work group? Do you have that figured out? Do you have that prioritized? And then what's your evaluation plan, both in terms of the impact you're going to have as a work group, as well as the process and how things are going. What does that look like? So one example that I think can be helpful. And again, you can tailor this to make it your own. And there will be worksheets available after these webinars, so stay tuned for those too. I picked two different examples of work groups and potential ways you could think about this. So one could be your access work group, another could be your radon work group. So come up with a list of your staff and leadership. Who are they? As well as your members. What are their names? What are their affiliations? Are they connected to organizations? Are they survivors? What do they look like? Then what is your implementation strategy right now? And then what's your evaluation plan? And within the implementation strategy, it's really helpful to think about more than just the overall piece. And the next slide will really help you kind of do that. But again, this helps assess what you are doing. The next piece will be able to understand who's doing it. So again, as I said, you can take that implementation strategy, which is one broad piece, and break it down. So I provided an example, and again, this isn't even the full breadth of what this would look like, but say you decided as a work group, you want to increase the tobacco tax. You're going to need to convene the work group. You're going to schedule meetings, maintain membership lists, those kind of neat things. You're going to need to engage grassroots, developing strategies to find volunteers. You're going to probably need polling to develop polls, fund them, implement them, assess them, analyze them. You're going to need education. Who's going to be able to do fact sheets on the impact of increased prices of cigarettes and what that will do to youth smoking? Again, there's a whole lot of other things that could come in this, but this is really important to think about. And as you think about the tasks needed, I encourage you to think about not only the implementation piece, but the infrastructure piece, things like convening work groups, or also the evaluation piece. What does that look like? What do you really want to learn at the end? How will you know there's a success or not, or what you've learned along the way? So one of the things that I found here is when you fill this out, it really helps you be a little bit more realistic with what timeline you need. So as I've mentioned in previous webinars, one of the things that I do with the Kentucky Cancer Consortium is I lead the Lung Cancer Network. As part of this, one of the priority implementation areas that the group decided to focus on was, let's really focus on implementing a policy that was recently passed, actually in 2017, that would reduce barriers to tobacco cessation treatment. And so we thought that sounds great. It's a perfect fit. There's a need. No organizations were really doing that collectively. So perfect fit for our network to really take on. Well, then we started saying, all right, what does this look like? And the strategy became multiple strategies. And we realized, wow, we have lots of audiences. We've got health professionals. We've got consumers. We've got like health systems. I mean, there's all kinds of people involved. And then we thought, well, goodness, there's all kinds of things that need to be done within each of those. And so really writing this down helped us say, you know what, in order to really do this right now and do it collectively, we're going to have to focus. So we focused initially on health professionals in federally qualified health centers to find out what they need and how we can get the best like tools and resources for them to be able to implement this new policy. So again, writing this down helps you be a little more realistic about what needs to be done and the time frame with which you can do it. So the next piece I'm going to encourage you is to really think about past experiences. What have you experienced in your work groups? It may be in a specific work group, or it may be in work groups overall. But as you think about it, what accomplishments have you made or not? What things have you wanted to do and you were able to do? What things have you wanted to do, but it just didn't really work out very well? Think about that. Kind of write these things down. Then find out in terms of involvement, what have things looked like? Who has said they were involved, wanted to be involved, and then actually were actively involved? Who said they wanted to be involved, but reality said they just didn't have time to fully engage as they had planned? Or that they, really wanted to take on certain things, but they couldn't follow through. Get to know that. And it's not to shame anybody. It's just to get a really good assessment on where you are. As you're assessing the situation moving forward, you need to look at the past. Then think about capacity. Your capacity in whatever role that may be, as staff, as a leader, as a work group member. What does that mean? And what kind of capacity do you have to be involved in any specific implementation area? Do you have an hour a week? Do you have 2 hours a week? Do you have 1 hour a month? What does that mean? And then lessons learned again. What else did you learn in this process? Did it take longer than you thought it was going to take? Did you end up having more things and more tasks related to the implementation than you realized before? Or maybe you realized you needed expertise that you didn't have. So what kind of things are you learning from here? I know something that comes to mind, and sometimes I would say, oh man, I remember this story. But this several years ago in our colorectal cancer work, we decided to create provider physician champion trainings, if you will, kind of a train the trainer situation. We thought it was a brilliant idea. We'll find physician champions in primary care, we'll train them, and then we'll get them to train others, and everybody will understand screening guidelines, and it'll all work really well. Oh, wow. There were many lessons learned in that, but one of those was, while our physician champions were able to come to these meetings or these events, the physicians that we wanted to come as well just weren't. They didn't have capacity to participate in anything additional. And so we said, oh man, we spent all kinds of resources. How do we make it work? And we realized that, you know what, we really need to switch our strategy moving forward to kind of reach these physicians that we weren't able to reach in the way we thought we could. So again, great lesson learned there that really is able to inform future events. So then my next kind of big piece, once you've assessed the situation, is connect people to their best fit. Now this may sound obvious, but I know that a lot of times we may end up in situations where, like, how did we end up doing that? How am I in charge of keeping up with the database, or how are you in charge with planning the meeting? You hate planning, those kind of things. So really taking the time to connect people to their best fit is critically important as you think about delegating or not delegating. And this really includes staff, work group leadership, and work group members. I mean, this is essential for folks to really get to know where they are, and that helps everybody really work well together. Look at their capacity, look at their gifting and their skills and their interest, and kind of try to combine that together. So here is an example of what that could look like. I've got Susie and Howard. I don't know if you have a Susie and Howard, but this is just for an example. And again, a grid that you can tweak and tailor based on what makes sense for you, but kind of saying, here's capacity for them, here's gifting and skills, areas of expertise and maybe interest, and then involvement in the consortium. One of the things that you'll definitely want to consider is maybe somebody's involved in the board, they're in 3 work groups, they're, also doing something else. They may have very limited capacity, and they may even need some encouragement to say, you don't have to be in every one of these. I know you have an interest. Where do you most want to be involved, and where do you want to most contribute? So again, the idea that Howard has 3 to 4 hours a week as a volunteer is probably unrealistic. But again, take the time to get to know these members. And oftentimes this can be done in a one-on-one way, a phone call or a meeting or a coffee, or a way to just get to know, where they are and even what their organization needs. The better you can fit what the work group needs with what their organization needs, those are win-win kind of situations. And there may be more capacity for folks to be involved in those areas. So I'm sure most of you are familiar with Stephen Covey and the 7 Habits of Highly Effective People. And many of you have seen a version or another of his quadrants and where you spend time. So the urgent, important things are quadrant 1. Those are the ones that we can easily spend all our time on. The non-urgent, important ones are the ones that, Covey encourages us to be in the zone. I will say these require scheduling. They're never going to come up as something that's, urgent. So you've just got to put time on your calendar. Now, quadrant 3 are those things that are urgent, at least to someone, but not necessarily important, particularly to you. They may be important to somebody else, but not to you. These areas of quadrant 3 are often the best areas that consider delegating or finding other people to work in this. I actually got this idea from one of our pastors at my church who also does some leadership work. He really kind of highlighted this as an opportunity, and I thought, wow, that is a really nice way to look at it, because the reality is you can't be in all these places. And so if you're in quadrant 1 and 2, what do you do with 3? They may find great importance, as I said, to somebody else, but they're not as important to you. So they may be perfect for somebody else to take the leadership on or provide, really support in doing. And then that quadrant 4, the less we spend time on it, probably the better. Quadrant 4 probably includes Facebook or Instagram, sometimes even email, right? From all the people who want to sell you their stuff. I don't know about you, but I get bombarded. Some of these people drive me nuts with all the emails I have to delete and then maybe unsubscribe to. But again, so thinking about this as Stephen Covey would encourage us, again, that Quadrant 3, maybe that's your place of delegation. So next, I know I'm getting into all these graphs and people this time, but I don't know if you all have heard of or familiar with the situational leadership model. This was developed by, Paul Hersey and Ken Blanchard. And basically they did it as part of a management of organizational behavior book and approach. However, it can be used in a lot of different ways. And so as you look at this, you basically have two different approaches. You have directive behavior, low to high, and you have supportive behavior, low to high. And what you'll notice in this piece is down at the bottom is delegating. But there's 3 other quadrants that are not delegating. So what this means is folks may not be ready to delegate certain tasks. You may need to be doing other things like directing, coaching, or supporting. The other piece is, and you'll notice here, delegating says low supportive and low directive behavior. It doesn't mean no supportive. I think one of the things we get into trouble with when we think, oh, I'm just going to delegate it is, oh, it's completely off my list. I don't have to think about it. It's in somebody else's corner. But that means no support. And that is really recipe for not getting it followed through with. You really need to provide even low support to folks to check in to see what's going on here. So I'm going to spend the next couple of slides explaining this a little bit further, and then we'll go back to it again. So directive behavior. This is really the extent to which a leader or a staff person may engage in one-way communication, spells out the follower's role, tells the follower or participant or work group member or student what to do, where to do it, when to do it, how to do it, closely supervises performance. This is on the high directive. I think some of you may be thinking, oh my word, this is a lot of structure and it sounds like micromanagement. Well, that is true. If a person really is already competent in an area, is really comfortable with what they're doing, they have expertise in something, and you provide all this, that's absolutely micromanaging. But if somebody is brand new to a situation and brand new in terms of understanding, how to do a specific task or how to do something within your work group, then this may be really helpful. This is particularly true when you're working with students. A lot of times students come in and they don't have any experience in what this looks like or what their role could be. And so they really need high levels of direction to know what's expected. And this can be helpful for a lot of us in many situations, particularly new situations. I'll never forget, and I continue to see this now, when I was working on my doctorate, I found myself at times a little frustrated, like, shouldn't I be able to do this? And my mentor told me, he said, no, you've never done it before. Why should you think you're able to complete a doctoral dissertation on your own? No way. That doesn't make any sense. So I needed some really high direction on where to go. And what I found is I've actually got a dear friend who is local, and she's working on her dissertation, and she's just struggling because she's not getting the kind of direction she needs. She needs directive behavior. So I'm kind of encouraging her, hey, here's some questions to ask your mentor to move this forward. So then supportive behavior is the other kind of axis, if you will. And this is the extent to which a leader engages in the two-way communication, really listening, providing support, facilitating interaction, involving the follower, involving the work group member, the leader in the decision-making. And so this is going to be a lot of your work group members. A lot of folks have a lot of expertise. They have confidence in what they're doing, the specific implementation area. So you really want to be supportive and helping people succeed in what they're doing. And so again, this may differ depending upon the task or the situation. Is this a new situation? Is this something that they've done before? And so it'll have varying levels. So looking back at our kind of quadrants, you'll see, again, directing. If somebody's never done anything, they're not confident, they're not competent, you're going to have high direction and low support. You're not going to say, hey, what do you think about this? Because they don't yet know. But then you quickly probably are going to move into high directive and high supportive, where you're saying, here's kind of the where we go. And yes, how's it going? Are you getting this? Are you with me? Do you have questions? Are there ways we can support or provide training? And then supporting is the next quadrant, which again, folks are saying, I'm feeling really comfortable about this, but I need you to check in pretty frequently and make sure I've got what I need in terms of resources. And then the delegating are when, wow, people think I've got it. And so you check in periodically, not never, but periodically, and this can move forward. Now this can apply to groups as well as individuals. You may have an existing work group and they have done implementation a long time and they feel really comfortable in it, and they're implementing another area and strategy and they feel really comfortable. Well, in this situation, those folks are probably going to be in delegating. There still needs to be support, but they feel comfortable in what they're doing and they're carrying on in that way. You may have another work group that is brand new, is trying to do a brand new implementation area. And so you need to provide some directing and coaching and really kind of looking at those situations. So again, assess your individuals as well as your work groups to figure out how you can best put people in their fit based on the situation, the task. And the other piece of this that is really helpful is when you assess people and you find out their best fits, it can be really helpful to put them in that. So you don't have to spend as much time in the direction and the supportive piece. You can move them more quickly into delegating rather than having them in these other areas that do require a lot more effort. And you may have people that have the gifting already and you can put them there and they don't require as much effort. So considerations as you're thinking about this, it's important to think about staff, work group leaders and members, and students. You really got to look at it, all these different pieces. And again, for the situation, as I've mentioned, we're focusing on work groups. This can be applied to boards and committees as well. So I'm going to encourage you all, and I've just had conversations earlier this week with some other states doing this a little differently, but assign at least one staff member of some sort to each work group. I know you may think, well, I don't have capacity. If you don't have capacity, I would encourage you to narrow the work groups to the number of staff that can support the work groups. The reality is, as I mentioned in the opening story, even though folks who are part of your work groups are very skilled, probably have tons of expertise, they usually have limited capacity, and they are serving as volunteers in this role. So the staff role is critical. Moving things forward, scheduling meetings, figuring out, making sure things are moving forward is huge. That's the staff role in many ways. And then thinking about work group leaders and members, it really depends on the person, their season of life, their situation, how closely this implementation aligns with their organization's priorities. Really thinking about that helps you move forward. And so then the other piece of that is asking them how they're doing, or asking them if it changes. And also encouraging honesty when you do ask, that they can tell you no, even though you may not want them to. Allow them that space and time to do that. And then students, again, this is an opportunity where with some training and guidance, you can really have additional support to your work groups and to what you're able to do productively by engaging with students. Many students need practicums or internships or other things like that. And a lot of times they're available even unpaid. And so this is an opportunity that the student can get a valuable real world experience, and you can get additional support for work group implementation. So additional considerations, and I mentioned this kind of before, is for any of your staff, work group leadership, work group members, recognize their seasons of life and their seasons of work group participation. And these seasons require different things at different times. So people who may have been really engaged at one time may have to step away and disengage depending upon the situation, or vice versa. Folks who originally were completely overwhelmed in a certain season, they may say, I've got a little extra time I can spend on this. This aligns well with what I'm doing. Let me get involved in that. So recognizing seasons, and again, encouraging people to be open and honest with what that looks like. Then also consider capacity. And this kind of goes hand in hand with seasons, but really ask, what is your capacity? And as you think about people who say, yes, I can do this and this and this and this and this, make sure you check in with them and think about past experiences. Don't shame them, but encourage them to really say, hey, we understand if you're not able to do all that you would hope to do. Consider people pleasing. I don't know about you all, but I often call myself a recovering people pleaser. I see something that needs to be done, and I don't want to let somebody down, especially people I really enjoy working with and I admire and I respect. That is great that you admire and respect those folks. But the reality is, if you say yes, 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 and then aren't able to follow through, you're actually not pleasing anybody. And so your desire to people please backfires. And so you really, you've got to consider those pieces and say, hey, I want to encourage yourself in that self-reflection, as well as when you work with others and find out their involvement, to say, you don't have to please me. I'm so glad you're a part of this. If this is the right time and season and expertise, join us. If it's not, we still want you to be connected, but it's okay not to take on these extra things. Then the last piece to consider is fear. This is almost connected to people pleasing, but I think there's a fear that people are saying, oh, gosh, if I don't do something now, will I be asked again? Or, oh, well, will they want me to tell them it's too much? I just need to suck it up and figure out a way to do it. But then you might get burned out and overwhelmed and then not want to participate at all. And you lose some of your best people if they're operating in fear, or if you're creating fear in your situation. You may or may not realize that you're doing that. The other piece, again, in this is to encourage that honesty and to demonstrate it yourself. Show that you are being honest about your time and ability to do things. And this can come from anywhere you are, whether that be staff, work group leadership, or work group members. Model that and lead up or lead across and lead down in terms of showing that honesty and that consideration. So the last kind of major category, you've assessed the situation, you've put people in their best fit, then revisit and revise. You may have figured out your plans, you've implemented, you've evaluated, but you're gonna need to revisit. Things may change, like it or not. Things do change, really. So it's important to ask these questions and to check in. You can figure out the timing that works best for you. I often find that once a year is a good plan for each work group to kind of say, how are things going and what do things look like? So here's some questions to consider as you revisit and revise. Are you making progress as planned? And are there new unexpected tasks that do not have people assigned to them? Once you've started implementation, you often figure out, oh, there's a lot more to this than I realized. As I mentioned in my implementation of tobacco treatment barriers and reducing barriers to tobacco treatment, there's so many different audiences, there's so many different strategies, there's so many people already doing different things. We really needed to kind of rein in what we were doing. So find out what that looks like. And I must say, I don't know about you, I have never, and I mean never, underestimated the time it was going to take to complete a project, particularly as a work group. Never. One of the projects I'm working on in Kentucky is working with work sites and several different staff in different counties in those work sites. I mean, we created a timeline thinking this makes sense, right? This is enough time to recruit, to engage, to implement, to evaluate. No. So the reality is you've got to check in. And maybe maybe you're better at this than me. And I hope that you are, that you kind of say, oh, I got it. I left in a little bit of space and lead time so that I can recognize there's going to be changes. So ask those questions, check in on that. And then the other piece is, find out how things are going. And again, this is not to shame people or poorly evaluate them. Just say, are people following through with what they said they were going to do? Are they able to do it? Are work group members still actively participating, or are they avoiding meetings? Are they not showing up to calls? Are they not participating in video chats? And they used to be, maybe they've gotten overwhelmed. Maybe they've gotten burned out. Maybe there's new priorities. Just, again, you've got to consider those things and say, why is it? I bet it's not because they don't want to do it. It's just things have come up. As I mentioned before, I lead our lung cancer network for the Kentucky Cancer Consortium. We met at the end of June. We created several different kind of next steps and follow through items. And then before I know it, July and August are gone, and our next meeting is scheduled for next week. And I looked last week and I thought, oh my, I'm revisiting all the follow-ups, all the different pieces that even I was supposed to do that aren't going to get done yet. Realized as well that everything is due in September. How did this happen, right? I don't know if you guys experienced that, but different months of the year, you're like, whoa, where did that come from? And so I really had to pause and think, you know what, rather than shame other people or shame myself and realize that there are just differences, what I decided to do is say, you know what, let's adjust the timeline. Let's meet instead in early November. Give us a little bit more time, check in, follow through, check in with myself, check in with others, and allow that time to move forward. That way, we're not meeting just to meet and using people's time less wisely, but we're meeting in ways that we're going to be more productive and that we're really going to encourage what we're going to do and be positive in that process too. People will want to participate when they realize we're giving them space and we're modeling that we're giving ourselves space. So then the next piece, and as I, showed the example of the story, is you make adjustments. You change your timelines. You adjust your meeting times. You try to get more realistic about what you're doing. You say, you know what, to recruit those work sites to participate in my project, it may take 3 months, not 1 month, because we don't have any relationships with them. You may also need to change your task or implementation strategy. Again, the provider training that I mentioned before, we needed to adjust what we were doing moving forward. And you may have started in a direction with what you're doing and you say, how could we change? But the reality is there's no momentum. People are not showing up. Things seem overwhelming. The timing isn't good. Maybe political situations have changed and the environment is not great for what you decided to work on implementing, and you need to make adjustments. It's okay. And then you may need to be able to change priorities. The reality is you may not be able to manage all the work groups that you plan to do. I know I'm saying that. The reality is you may have to prioritize for a time. Some work groups, and we've done this in Kentucky off and on, become more informational. So it's not so much that you're not connecting in terms of what people are doing, but you're making connections rather than working all on implementation strategies. Again, you've got to assess the situation, find the right fit, revisit and review and say, is this right? And do we need to adjust our priorities? And that way you've got successes. One of the things we talked about early on, the second webinar in our partnership and collaboration series on consensus building and priority setting, this kind of leads right into that you really need to say, what can we really do, and make adjustments there. The other piece in terms of making adjustments is you may need to change those who are responsible. You may have discovered that folks who originally were able to devote the time you thought they could are no longer able to devote that time. You may need to make adjustments. You may need to increase staff time and involvement, or you may have staff turnover. And so you need to provide training to staff and bring people up to speed on what's going on. One of the interesting things, and you guys may or may not be aware of, CDC provides funding, as you know, for comprehensive cancer control programs and different things. What you may not know is as of the last 2 years, they created a 40% salary and fringe cap that you can't provide salary and fringe. And so beyond 40% of your budget, which in theory, I see that. They want to move money toward implementation. And I think it's worked out okay for Iowa. You guys have gotten kind of creative, but for a lot of states, that really hampers the ability to move forward. Because as I mentioned, staff is critical to making this move forward. Also, your work group leaders and members are critical, but everybody plays a different role. So we all need to have that involvement, and making adjustments. Oftentimes, what I've discovered in work groups is we need to spend more staff time, not just delegate things to everybody as volunteers, but spend that staff time. The other piece, you may need to invite and involve new work group members. There may be some areas of expertise that are just missing, and you think, I need to think more creatively and work with your members and your leaders and your staff to say, I met somebody the other day that might be a perfect fit. Or think about your overall Iowa Cancer Consortium membership and say, what, I haven't heard from Susie or Howard again. What kind of folks might be a good fit for the implementation you're wanting to do right now within your work group? And again, as I mentioned before, identify students to provide support. And these students may really be just tremendous assets to your work groups. They're going to require some training and probably some high direction, high support, as we talked about in the situational leadership piece. And you may not be able to fully move to delegation, but you can absolutely provide some win-win opportunities as you think about moving forward work groups. So I'm going to pause for a little bit and provide an opportunity for questions. And then I'll kind of come back and we'll revisit some areas and wrap up the training. So Kelly, do we have any questions?
Thanks, Jennifer. As a reminder, you can ask questions by using the chat function, or you can also raise your hand through the Q&A function. I will pause here for a moment and give folks a chance to do either of those. All right, we'll have an opportunity to answer questions at the end as well. But as of right now, Jennifer, we don't have any that have come up.
Okay, Okay.
Thank you.
So you are welcome. Thank you. Oh, did we have something come up?
We did. We had one come up.
Great.
Can you
Yes.
tell us about a time when a delegation went poorly and what did you learn?
Yes. Gosh, let me pick the example. I think several examples. I will say one of the things that I have found where the delegation went poorly is working with students. As I said, students can be great, but I had a situation where I brought on a student and she was really excited about evaluation efforts. And she was like gung-ho, let me get involved. And so I kind of showed her some stuff. And then I said, okay, are you ready to go? And she's like, yes. And she was ready to do key informant interviews and, really get some information on our partnerships. And then I discovered that she was spending like an hour and a half with each of these partners. And I mean, it was taking so much time. And then when I asked her, like kind of what she was doing, and she said, oh, I've got all this good stuff, which she did, but she took up a little bit too much of my partner's time. And our partners were like, I can't be on the phone this long. Then when I had asked her to kind of organize her thoughts, she provided me like a 40 page document. Like I was like, oh my gosh, this is way too complex, but I had not given her the appropriate guidance and direction on kind of expectations and how to kind of facilitate a conversation or even practice some of that. And so I had assumed she's excited, she kind of knows what she's doing. And so I just delegated this whole project to her to assess what's going on with our partnerships. And I needed to spend a little bit of time saying, oh yeah, should have done something different there. That's one of the examples. I think another, as I think about, is even among work group members. So I've had I think about the colorectal piece and even the physician training. We had a physician work group where we were trying to say, okay, what do we do? And we had one particular physician and he had lots of ideas and he said, oh my gosh, I'll totally take care of this, but he never did. And so I really decided, you know what, rather than just saying yes, 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 I really kind of said, you know what, let's start with one thing and create a little more parameters around that. Say, so by what time do you think it's possible to be able to finish this or contact this person? How can I support you? What does that look like? Rather than just saying, sure, and then it doesn't happen. So anything else?
No additional questions right now.
Okay, excellent. Well, thank you for the question. Good question. And we'll carry on and revisit some of what we've learned today. Okay, so to delegate or not. Again, there's 3 big things I want you all to take away with today. Assess the situation. Figure out what it is you want to do, all the things involved in it, who's involved in it. Do you have leadership? Do you have a focus? Do you have the energy around it? To see what's going on. What's the past? Assess the situation. Number 2 is connect people to their best fit. Again, this is critical. And I think if you have participated in something where it is your best fit, it's kind of exciting and engaging. I know one of the things I do just as a volunteer as well is do this at our church. And I have so much fun doing this. And it's amazing where people get excited and they're like, yeah, this is where I want to be. I've never really discovered this before. And so I think when people are energized and in the right fit, they're more likely to follow through with what they want to do and able to devote the time and those kind of things in delegation. And then the third piece, as I am reminding you, revisit and revise. Things change, seasons change, and it's important to check in and allow people to be honest and have the space to disengage or to re-engage. So again, assess the situation, connect people to their best fit, revisit and revise. So as I showed you earlier in the presentation, here's a potential grid you can use. And again, I will provide some worksheets as a follow-up to this that will allow you to fill in your own grid and what that makes sense and how that looks for you, really understanding what you're doing, who's involved, what you want to do to kind of see that piece. And then as you really, again, provide people in their best areas of fit, I think this is important to kind of think about what those look like. Spend the time to get to know these folks, what's important to them, and, again, what's important to their organization. How is this going to align? It's not here, but could be added for sure. And then finally, a reminder, it is okay to make adjustments. Things change, people change, And we all appreciate having a little bit of space and grace to be able to move forward together. It creates that trust that allows people to want to work with you when you provide that space to make adjustments. Work groups change, and so do situations. Recognize that they don't have to change all the time, but things do change, and give people an opportunity and encouragement to be honest when they are changing and that they may not be able to follow through as they planned. Then also recognize that we often do not realize until we get in the middle of it, all that it's going to take to implement something. Really take the time to pause, to add, to reflect. And then if we've got a lot of new things that need to be done and not new people able to do them, then maybe we need to recruit more folks, or maybe we need to narrow our list and focus in one area first and then work on those other areas. And again, if you wanted people to keep participating, be willing to adjust. We all appreciate that. And not that we need to change all the time and that people have no idea what we're actually doing, but just focus in an area and then make those adjustments and be willing to adjust. So then action steps. So my final piece is to really say, okay, as we've had in every other webinar, schedule 15 minutes before this time you have an extra time because we're on a Thursday, before next Friday to think about your work group involvement. And whatever your role may be, whether that be leader, member, staff, are there ways you want to be more involved in implementation or less? And if you maybe have ideas for others to be involved, that's great too. And I'm going to encourage you to email Kelly with your ideas. You have her email address, I'm sure, in other areas. And then also I'm going to encourage you to visit my website, as Kelly mentioned, jredmondknight.com, for more ideas and suggestions, really on decision-making and delegation in my blog posts. And so what I will encourage you guys is to say, you know what, there's always kind of more you can learn and more you can do, but don't give up. You know, there's adjustments that can be made. It can still work out, even if it hasn't worked out great before. So thank you for your time.